Without further ado, I'd like to introduce our panelists that we have with us this afternoon. First, Eric Samuels. Can you wave, Eric?
Glad to be here.
Eric is the CEO and president of the Texas Homeless Network. He has had 23 years of experience working with local, state, and national organizations on the development of systems designed to make homelessness rare, brief, and non-recurring. I always love that statement. Since 1997, Eric has helped strengthen Texas continuums of care, including building the Texas Balance of State Continuum of Care program at Texas Homeless Network. In August of 2015, he became the president CEO of Texas Homeless Network. He holds a master's in sociology from Texas State University and a bachelor's from the University of Arkansas. Welcome, Eric. Thank you for being with us today. Second, I'd like to introduce Michelle Miles. She's waving at us. Thank you, Michelle. Michelle is the acting program manager of the Homeless Services Division with the Austin Public Health. She has worked in human services field for 20 years with a combination of direct practice, program management, and system design experience that encompasses a variety of populations in many areas of focus. In her current role, Michelle works across many of the city's departments and with community partners like Caritas of Austin to develop interventions and address the needs of people experiencing homelessness, not just right now being impacted by COVID-19, but during all times, and how homelessness impacts them. Michelle holds a bachelor's in psychology and a master's in clinical psychology, both from the University of Alaska at Anchorage. So welcome, Michelle. Last but not least, we have Jason Phillips. Welcome, Jason. Jason is the Deputy Director of Permanent Supportive Housing and Integrative Services with Caritas of Austin. Jason is a licensed master social worker and has overseen multiple housing and support programs while at Caritas and has experience implementing statewide VISTA programs when he himself worked with Eric at the Texas Homeless Network. He's worked with housing and homeless and housing services for 7 years, both direct practice and in leadership roles for nearly 10 years. He experienced in managing private residential rental properties and working with multiple criminal justice reform advocacy organizations. Jason has a very strong belief in a housing first and harm reduction model and as an equitable solution to ending homelessness as we know it. Welcome, Jason. All right. So we're just going to kick it off today, and I want to first address a question to you, Eric. The City of Austin has adopted Housing First as a strategy to end homelessness. Can you tell us what Housing First means?
So Housing First is a strategy that prioritizes moving someone from the street or shelter directly into permanent housing, as opposed to having that person jump from station to station and to achieve different benchmarks along the way. The belief behind this is that if someone has housing stability, food stability, then they can start working on other issues in their lives that may need improvement. You know, it's going to be much easier to work on your employment needs or your health needs if you already have that stability in housing and your food secure as well. Another thing that makes Housing First unique, and I think Housing First programs that work really well have this, is that you need to include client choice. So the client is involved in choosing what type of housing, where they're living, and what type of supportive services that they take advantage of, as opposed to someone dictating where they live and what type of supportive services they will have to engage in.
Thank you, Eric. So to build on that, how is Housing First different from other approaches?
Yeah, so I started kind of answering that question, the first question, but Whenever I started this work in the late 90s, the idea was that, well, transitional housing was considered an innovative approach. And part of that innovative approach was having people move from emergency shelter to transitional housing and then to permanent housing. And then along the way, you know, achieving things like achieving sobriety or working with psychiatrists to work on mental health issues. So this is different in that it does not involve any of those preconditions. You move straight into the housing, and then you can start to work on the issues that you need. It's also different from the standpoint of really prioritizing the client choice as opposed to us dictating what that person will have to do, what kind of supportive services that person will have to take advantage of. And the idea behind all that is that if you have more choice, then you take more ownership. And of course, you're going to take advantage of those supportive services more often, which only increases your housing stability down the road. And it has proven to be a very effective model to be used.
Would you mind, Eric, expanding on how is this? What are some evidence of it being an effective model? Can you give us some examples through your years of experience?
Yeah, so I mean, we have a lot of evidence, a lot of research in the past, definitely the past 10 years that have proven that Housing First does work, and we're continuing to build that data set up to this day. It is, number one, it is an effective approach. Number two, it's a very efficient approach as well. Housing First programs often report successes of between housing stability of a person for a year or longer of 75 to, I've seen it up to 98% success rates, which if you compare that to shelter programs, you know, it blows those success rates out of the water. And again, a big part of that is housing choice or housing choice and choice from the client and what support services that they engage in. Another thing that's, I think, not talked about often is how cost efficient it is. If you think about operating in a large emergency shelter or transitional housing facility, that's going to require a lot of utilities, that's going to require a lot of staff. Ultimately, all of this, it adds up to be very costly. Now, if you put someone directly in a unit, you're helping that person through subsidy, often pay for that rent and utilities, and then you're supplying supportive services. But ultimately, that ends up to be far less costly for a program to operate. So there have been studies that have shown that permanent supportive housing and the use of Housing First can save communities up to $31,000 per client. Forbes did a study a few years ago that it looked at 150,000 chronically homeless people across the country. And people experiencing chronic homelessness, they often end up costing communities a lot of money. Forbes estimated that cost across the country was around $11 billion. Then they estimated how much cost those folks would cost their community if they were in permanent supportive housing, and that was about $3 billion less. So programs like these, they ultimately are better for the client, they're better for the community in terms of cost savings and just bettering the community overall.
It's a lot of money, Eric, when you start really putting dollars to how much cost savings it is for our community. I'm going to go down to Jason real quick, just because Jason with Caritas of Austin can talk a little bit about how the Housing First model is actually implemented here locally. So we use the integrative team approach to Housing First here at Caritas of Austin. Can you tell us kind of what this means and why it's essential to building well-being for our clients based on Eric framing Housing First for us?
Yes, thanks, Amy, and thanks, Eric, for that description of Housing First. As Eric was saying, housing is really the foundation. However, what we know is that there's a lot more factors in people's lives that contribute to well-being, better health outcomes, housing stability. And so what we're really looking at is an integrated approach, because we're looking at folks' psychological, their physical, their emotional, their social well-being and factors and needs, and seeing what services that we can individualize for that client. Prior to Housing First, a lot of the housing programs were more, this is our program, here are the services you need to complete to be able to be successful in housing. Where what we're really looking at in Housing First is, here is you as an individual in housing, and then what services can we wrap around you and individualize to meet your needs to be able to remain in housing. A big piece of it is we do have some interdisciplinary teams. It's not just case management. We also have peer support that work on recovery and treatment with clients. We have community housing specialists that really focus on the housing piece. So the clinical team or the case management team can have that be their main focus with clients. In addition, we have other programs that complement our housing programs. We have an education program that has classes that range from financial literacy to creative writing. We have an employment program that we, I believe about a year ago, started the pilot for, and that is a supported employment program where folks not only work on job readiness and applications and job placement, but they have someone to work with them one-on-one after they're already employed to help mitigate any issues in that transition of employment. In addition, we have a city with grant, with the City of Austin, our behavioral health services grant. We're able to provide in-home counseling, or right now a little bit more telehealth counseling, clinical services, and substance use treatment, if that's something, again, that the client and the professional has identified as a goal. And lastly, we do have our food services. We have a community kitchen that's open to all downtown. And then we also have pantries and grocery services for our clients within our housing programs.
Thank you, Jason. So very robust wraparound services for those that are moving from the streets into housing. So thank you for elaborating on all of those programs. I know housing, and I'm gonna address this to Jason, but then I'm gonna shift to Michelle too. Housing is an issue here in Austin. Affordable housing, I should say, is a huge issue here in Austin for many of us. And so this can be a barrier, not just for those experiencing homelessness, but organizations like ourselves who are trying to find housing to place folks in. So speak a little bit, Jason, to how Caritas deals and works with the community to find that affordable housing, as well as we're going to pivot a little bit over to talk about specifically how have we done this during our current environment during the pandemic.
Right, so our partnerships within the community are really what make us be able to have a housing first approach and to be able to quickly house folks in appropriate and affordable housing once they're referred to our programs. And those relationships, are not just with other nonprofit or affordable housing developments. They're with private property owners, private property management companies, and it really takes the whole community, not just the service provider, to be able to not only move folks into housing, especially with such a tight housing market. I would say just briefly, we've had to be quite creative over the last 3-4 months. There's a lot of documentation, there's inspections, there's wanting to see the unit before moving in. And so there's a lot of documentation gathering you have to get, for example, at DPS. And so the case management team, the community housing specialists have had to, really work creatively with the client, with the property managers to be able to continue our housing rate and moving folks into housing when, especially right now, when it's really a public health issue, not just a housing crisis issue.
Thank you, Jason. So Michelle, will you tell us about the work that the city is doing to improve efforts to get people into housing? And you can speak specifically or generally around, depending on the environment. I know right now it looks different. We can address that in the next question.
Okay. Well, the city has hired national consultants, and The city hired the consultants prior to COVID-19, and they've continued to work with us during COVID-19 response. And they were hired to do a deep dive analysis of our homeless response system. And we are investigating different rehousing strategies, defining certain things such as rapid rehousing, permanent supportive housing. What are those things? What do they look like? And then also we're marrying that with the funding streams that are coming into the city as well from the CARES Act, as well as coming through city through city funding to make sure that we're able to move people into housing quickly, that we have the strategy in place, the housing, the money, and then the services that follow. And we're also doing some modeling of the homeless response system. So we're looking at the point in time count, the HIC, which is the bed count for different services, and seeing where there are gaps. And we're looking to find strategies to fill those gaps.
Thank you. So with the COVID-19 pandemic, those of us working with the homeless population definitely feel more of an urgent need to house people quickly. Can you explain why people experiencing homelessness are more at risk and why housing is particularly important now more than ever?
COVID-19 has shown us that housing is a right, that it is necessary. People who are experiencing homelessness have higher instances of health issues and health issues that are that increases the likelihood of them having a negative health outcome if they become infected with COVID-19. So there are people who are experiencing homelessness who are on dialysis, people receiving chemotherapy who are immunocompromised, who are on hospice and experiencing homelessness. And because of that, it's really important for people to have access to housing. In addition, people who are experiencing homelessness have experienced significant amounts of trauma in their lives, not to mention the act of being homeless is a traumatic experience, which impacts our immune system and our ability to engage in planning for our lives, whether it's health planning, whether it's housing planning, whatever kind of planning it is. Just the act of being experiencing homelessness impacts that. In addition, being homeless, you don't necessarily have access to water, soap and water, so that you can engage in the things that you need to, like washing your hands, good hand hygiene. And also experiencing homelessness does not afford necessarily you the ability to socially distance from people. So because of all those things, housing is important for the individual. It allows the individual to engage in their healthcare and whatever other things that they would like to engage in, and improve their quality of life and well-being. For the system, it helps the system by keeping people healthier and not creating a strain on the healthcare system. And for the community, it really allows us to lean into easing human suffering. So housing is very important, and COVID has definitely exemplified the need for it now.
Thank you, Michelle. Jason or Eric, do y'all want to add anything to that question? I definitely think it's top of mind for us all working in this.
Yeah, I agree with everything Michelle said. One thing also we might want to consider when we're talking about COVID and homelessness is that when people are experiencing homelessness, they are obviously not in a place that will allow them to socially distance. They can't quarantine themselves, and oftentimes to get the just the basic necessities that they need, food, water, they have to travel by foot or by public transportation across the city. And when we have people traveling around the city, there's greater chances for infection. And so all of these things, they really culminate in the need for more housing and to get people off streets and out of these congregate shelters.
Thank you, Eric. So I would love to ask the question, and I'll pitch it to Jason to be the first to answer this, about tell us some real success stories around, especially, you know, for clients that we have housed since our March 17th date, and using this housing first approach, and why it's been so important, especially to adhere to this model during our current pandemic.
Thanks, Amy. Yeah, I'm proud to say, Eric mentioned earlier about a 98% success rate. Our supportive housing program, both in 2018 and 2019, has had a 98% success rate in folks that remain in permanent housing. And that is, a lot of it is due to the interdisciplinary approach and integrated approach that we talked about earlier in providing community-based services. But a big piece of that is the housing first and harm reduction philosophy and model, to where folks are not being exited or terminated from a program because of, you know, some arbitrary or some specific guidelines that don't necessarily contribute to or is needed to for someone to remain, you know, in housing. And so we've seen a lot of the impact in that, I think, over the years. We can also, one thing I want to point out, Eric was talking about some of the costs related to keeping people homeless versus putting people into housing and supporting folks in their housing. We have a pilot program that's been going on for about 2 years. It's a permanent supportive housing intervention, and the target population, so the clients that are being served, were chronically homeless, and then also the highest utilizers of emergency crisis services within our continuum, or within the Austin community. So that can include, you know, our law enforcement, criminal justice, emergency rooms, psychiatric services. And we have, and I'm going to pull the numbers up to make sure that, so I think it's important to make sure I get these right. They did a pre and post tests, and so they compared 18 months prior to program entry, so when those clients were currently experiencing homelessness, and then 18 months after being within the program. And what the data shows is that there was a 92% reduction in emergency room visits. There was an 88% reduction in the use of EMS or 911, specifically for a health crisis. There was a 71% reduction in outpatient. And so this really highlights what Michelle was talking about earlier, is that housing is healthcare, and the work that the staff do with clients to connect them to you know, health insurance, but to primary care, and to access those community resources that if you're experiencing homelessness, you don't necessarily have that privilege or the accessibility to do that. And so we see it as, yes, it's a cost effect. We see the positive health outcomes, but we also, you know, we see that folks are no longer relying on an inappropriate use of resource, really. And so as a community, we can leverage those resources to be able to, again, provide more community-based services, more housing services, so folks aren't having to rely on crisis services, which in a time like this, our crisis services, our ERs, need to be able to focus, you know, on the pandemic and other, you know, serious crises and health concerns at that time. So I would say that kind of highlights, you know, and especially related to health services and our pandemic, some of the, you know, real successes across the board that we see, and the impact that we see when we're following a housing first philosophy.
Thank you, Jason, for that information. We've started having questions come in from our attendees, so thank you guys. And I'm going to start working a few of these through some of these. And Jason mentioned some data specifically around programmatic services, but there's been some questions come out. Maybe Michelle or Eric could speak to a broader picture of the data regarding rates or percentage of positive COVID tests among the population of those experiencing homelessness. Is this data being separated of those that are in shelters versus those that might be living in encampments at this time?
Now, we're looking at the data rates for people experiencing homelessness. And we've only, last I saw, which I think was last week, we've had about 54 people experiencing homelessness that we're aware of that tested positive for COVID-19. There were some positive cases in the emergency shelters, but those have been identified, and people who test positive who cannot socially isolate, they can go to the isolation facility, which allows for social isolation. And if they meet the high risk category, then they can move into a protective lodge that we set up for people experiencing homelessness.
Eric, are y'all seeing similar numbers in other communities?
So yeah, you know, in Texas, I don't think we're testing as much as other cities are or other states are in terms of testing people experiencing homelessness. It's hard to say. I mean, I definitely would defer to Michelle when we're talking about data from Austin. I have seen studies from Boston. I was just trying to find the study because I didn't want to get the percentage wrong, but I want to say they tested everyone in their emergency shelter inventory, and it was a pretty large percentage that tested positive, but most were asymptomatic. So, you know, that's one city. It's hard to, you know, extrapolate from that, but I think it's very possible that we have, you know, a fairly high percentage of people that would test positive, but most are asymptomatic. That's probably across the board, though, for the population. So it may not be that much different than people experiencing homeless or people that are housed. But living in a congregate shelter, living in encampments sure can't help.
And speaking to the congregate shelters, the Salvation Army, Downtown Shelter, all the Salvation Army shelters and Front Steps have done a lot of work partnering with Austin Public Health and ECHO to reduce the capacity of the shelter to allow for social distancing and implementing different CDC guidelines to help to reduce the spread of COVID-19. There was some testing also done at the state encampment, and the positive rate was also low there. I think, I don't know what the current COVID numbers are today, but last week, Wednesday, I think it was around 6,900 positive cases in Austin Travis County. And at that time, I think the number that we know of people experiencing homelessness was around 54.
Yeah, I just want to add that, you know, we've been working with the HUD disaster TA team to address this issue across the state. And Austin's always cited as one of the cities that responded quickly and responded very well. So, you know, I have to applaud Austin for the way they've responded, and of course the homeless crisis response system here.
That's good news. Thank you. So you mentioned, Michelle, that we are able to place people in some temporary sheltering. I know that there are some folks who have not been placed in housing yet, but during this time we've been able to place them in motels or for temporary lodging, just to get them somewhere out from being on the streets.
Mm-hmm.
The question that's come in is, what will happen to our unhoused neighbors currently in motels when the pandemic is past? Excuse me. This could be for Michelle or Jason.
So for us, we are working feverishly to come up with a strategy to ensure that people who are in the pro lodges, when the pro lodges have to demobilize, are linked to housing or placed in housing, but not in unsheltered homelessness. So we're currently coming up with some strategies to see that through. So the staffing needs of the pro lodges to make sure that happens, possibility of prioritization through coordinated entry, to make sure that the people in Pro Lodges are moving into housing. We're looking at funding strategies as well for the Pro Lodges to make sure that these things happen. So we are definitely dedicated to finding housing for people at the Pro Lodges so they don't enter unsheltered homelessness. And we have multiple teams working on it.
Thank you, Michelle. Jason, did you want to add anything to that?
Can you repeat the original question? I missed the end of it.
Yes. Those that are unhoused and currently living in motels during the pandemic, what will happen after the pandemic has passed?
I think the show covered that, really well and holistically on the city side. And I think what we'll see in terms of service providers is a lot more coordination and maybe targeting folks so they don't have to get the re-traumatization of going back into homelessness prior to being picked up or moving into housing. And so I think some of that prioritization, it might look a little bit differently, but I mean, I think our response is Caritas and then the other service providers that we work really closely with is we'll keep continuing to house as many, folks as we can and as quickly as we can when we're able to.
So a question that's come in that's going to shift this a little bit is kind of a broader systematic question is what is needed to implement the Housing First model at a large scale? So Eric, this might be something you could tackle.
Well, I mean, the first thing I think of is that if you want to implement Housing First, you need to have units to access, to put people in, to have them have the opportunity to access. So I think one of the first things we need to do on a large scale, and it's unfortunately not a quick solution, but we need to expand our stock of deeply affordable housing and affordable housing for our citizens across, Austin, Travis County, and Texas. So that's the number one thing we need to do.
So to build on that a little bit, bringing it back to a local level, how do all these groups work together, whether it be the city, whether it be other organizations addressing homelessness beyond Caritas of Austin? Michelle or Jason, could y'all give us a picture of how the organizations work in the real world?
So currently, we are working with the consultants, with ECHO, with community partners through a project management structure to address different areas of the homeless response system. We have a hotel motel implementation team, a funding team, a rehousing team, and a modeling team. And so we're working to model the entire homeless response system to see what the real need is, and then to see what funding is out there, what funding is needed, what housing stock is out there, what services are needed to provide a robust services and funding and housing units for people experiencing homelessness, and then take that information to be able to implement strategies. And this is across the entire community, across the city, with ECHO, with community partners, because the only way we're going to end homelessness if we have an accurate picture of what's needed, and then to really make the ask that we need, to really take a deep dive and lean into it. So the city is committed to taking that deep dive and leaning into ending homelessness with our community partners and with ECHO.
I think to expand off that, any community that's getting HUD or federal dollars, either through Emergency Solutions Grant or HUD dollars for permanent supportive housing, rapid rehousing programs, emergency shelter, they have something called a Continuum of Care. And when Michelle mentioned earlier, ECHO, who manages that Continuum of Care, but Austin's been in a unique space where we've really worked very hard for many years really create that collaboration. And so when we do have, you know, a crisis such as this, most of the players, not all, so that's something we can always improve on, but most of the players are already at the table and are already having discussions about how to, you know, better, more improve our housing crisis response system. And so it is a huge, you know, collaborative effort among service providers, the city, you know, other municipalities, and other systems that are folks who are experiencing homelessness interact with. It's not just about housing. It's the criminal justice system, foster care system, you know, education system. And so there's always room for, you know, improvement there. But I do think that we're in a unique position to where we already have that strong collaborative effort. Again, it can always improve, but I do think that that helped a lot in terms of the pandemic response. Eric can talk more about the continuum of care outside of, of a large city like Austin, because it's a little more complicated.
Yeah, I don't know. That could be its own webinar right there. I'm not sure we want to get into that, but I should have added, you know, I think whenever I say, you know, we need to expand our housing stock, it could easily be interpreted that I mean, you know, we need to construct more housing. We do need to do that, absolutely, but we also need to find other innovative solutions to expanding our housing stock. And I think Caritas does a great job of working with landlords, engaging new landlords to participate with them on housing clients. That's one way. Another way could be, you know, to rehab units so that you can use those units against federal subsidy and state subsidy. There's a lot of solutions. I think what Austin's doing, what the Continuum of Care here is doing, and looking at, you know, refurbishing hotel spaces into affordable housing. I think that's a solution that should be looked at as well. There's a lot of ways to expand housing stock.
And Austin has developed a hotel motel strategy looking to create or increase the permanent supportive housing stock. So that is in the works right now. We purchased the Roadway Inn. Right now that's going to be used for bridge housing, and we're looking for other apartments that are more suitable for permanent supportive housing. And also during the crisis response, we also developed or created a food access initiative for people experiencing homelessness, and it's called Eating Apart Together. And we've distributed more than 100,000 shelf-stable meals, as well as prepared meals to people experiencing homelessness. And we've done that in collaboration with city departments, Travis County, and community partners to actually deliver the meals out to people in encampments. And from what I understand, that this has not been done in the country. So we're very proud of our EAT initiative. And with the food that we provided for people, we've also provided toilet paper, water, hygiene items, masks or face coverings, COVID-19 education, as well as pet food for people's pets. So we've done so much work to try to make sure that people's needs are being addressed during COVID-19, as well as we've put hand washing stations in the community, porta potties, the violet bag locations, which is where people experiencing homelessness can have their trash picked up. That has been increased to the pickup to once a day, 7 days a week. And by the Terrazas Library, it's twice a day, and they put out multiple cans for people and Austin Resource Recovery did this in conjunction with the EAT initiative to help deal with the extra trash that was created from the food access program. And we've also developed a communication strategy. We're developing, you know, there's a basic needs site on our website where people can access basic needs, and there's a mapping. There's also texting technology that we're investigating, which would allow us to send out mass text to people experiencing homelessness for information sharing. There's a lot of different things that we're working on with the city to support the COVID response, and also to support improving the homeless response system, and to include funding and moving people into housing.
Thank you, Michelle. We've had a question come in that's specific to talking about once someone is housed, how much more difficult is it to provide services otherwise before they might have been in a shelter? And so you might talk to our audience about how that happens. If they are more spread out in the community, how does that look in service providing? And Jason, this may be geared to specifics. I know there's other models being used throughout our community, but speak specifically to how Caritas manages this with our program offerings.
Yeah, I think there's definitely some logistical challenges, especially when our community is fully open and there's lots of traffic and having to drive all around town. We do have folks in our housing programs that live all throughout Austin, Travis County. And in our service model, although we do have, offices where folks, especially before they get into housing, can come in and meet with staff, our service model throughout all of our programs is really community-based services. And so we've seen that the best thing often for our participants is that we're meeting with folks in the community, whether it be in their home or in a setting that feels appropriate to them. And so I think some of that is just again bringing versus folks coming to you for services, bringing services to locations to really cut down on any barriers that might have for either access or transportation barriers to be able to get those services. So I think part of it is just that that strategy there. I think the other piece, especially during COVID in a pandemic right now, is just some of that the safety protocols around when you're providing community-based services.
So there's been a couple of questions specifically coming in around the funding that was given out by the city. Specifically, the acronym is RISE.
Mm-hmm.
And I don't know, Michelle, you might want to speak to this a little bit because it was a city initiative, but I'm happy also to share some information on that might give our audience just more insight on how that funding is being used. And there are folks that can access that funding in our community. You want to elaborate on that, Michelle?
The RISE funding is designed to provide relief for people due to COVID. And there's some limitations in terms of funding amount for family size, for family size. And also, but the dollars are very flexible. And I don't know how many agencies have received the RISE funding. I think Caritas has, and some other agencies have, but it is designed to help people prevent homelessness and to take care of basic needs. And if, Amy, if you can provide some more context that you wanted to share, that would be grateful as well. That'd be good.
I will do that. I will share that in our chat that they can access the phone number as well as an email address in just a moment. We'll finish that towards the end. So we are drawing to a close with our time together. If everyone's got a little bit of time, we can keep going through a few more questions that have come in, but want to be respectful to end appropriately here. I think there was a few more questions as a follow-up to the number of homeless individuals that have tested positive for COVID-19. One in particular is once they quarantined and tested, or first of all, the question is, are they being retested before returning to the streets? And what is the percentage there of those that are recovering? You want to quickly address that if there's
retested from the isolation facility? Is that the question?
Yes, I'm assuming, or once they test positive, what is the next steps? Is it just a quarantine for 14 days and then they're returned to the streets, or is there an intervention happening? What is the next steps for those 50?
If someone tests positive or has symptoms and exposure, they can go to the isolation facility. There at the isolation facility, you will do a 14-day quarantine. It depends. And also you will get tested and then retested. I think that the procedure is, if you have a positive test, you wait out your time. At the point that you are symptom-free, going towards your 14 days, then they'll retest you again and then give you another test within 24 hours to make sure. And if you are high risk for having negative health outcomes, if you contract COVID-19, you are given a room at the Pro Lodge. If you're not high risk, if you're low risk and experiencing homelessness, you will be offered a room at one of the shelters.
Thank you for that. We are going to be wrapping up our time together. Is there any final thoughts that our panelists would like to share with our group? And then I'll close this out.
Well, I just want to thank everyone for joining the call and providing us the opportunity to have this conversation. I think is really important. Housing First is a very crucial strategy to ending homelessness. And we need to think of ways to expand services and funding for Housing First, especially for people who are homeless adults not tied to a priority population, which I think makes up about 70% of the homeless response of homelessness. And oftentimes people may not have income. And so I would like for us to lean into housing people not tied to a priority population without income and housing. I think that's very crucial. We need to go after public-private partnerships, come up with unique strategies, ask for the services that are needed, and be very thoughtful in our approaches to providing services to people experiencing homelessness in general. But so I just want to thank everyone.
And I want to echo what Michelle said. I really appreciate being asked to be on this panel. And I just want to thank Caritas for all the work that they've done throughout the years. I've been involved in some way or another with Caritas since 1997. The great work just continues, and you're doing more and more. I think what Michelle said about leaning into permanent housing and leaning into Housing First is something that's very important. I think it's something that we need to do in Austin and throughout the state and throughout the country, especially when we think about returning to, quote, life as normal, because I think we really need to start talking about what's the future of congregate shelters, and what role is that going to play in our homeless crisis response systems, and how we might transform those systems where we're leaning even more into that permanent housing solution. I think that's definitely worthy of our discussion down the road.
Yeah, thank you all. Appreciate your time and wanting to have this discussion and conversation. And hopefully this conversation continues. I just want to leave with one of the things that I think a Housing First approach takes out of the equation is who deserves housing and who deserves housing when and how. And so I think especially what we can learn from, a time that we're going through now is that housing, it's not just about who deserves it, it's a public health crisis and should be a public health response. And I invite folks to really approach it in that way and come together to house more folks and expand our healthy community. Thank you.
Thank you all. And I want to thank all of our attendees today. Again, this will be recorded and shared through our social media channels on both Facebook and Twitter. We want to invite you to join us for future conversations. Depending on what our environment looks like, our next one will be in the fall and more than likely might be virtual again. So please be looking for that. If you would like more information, have additional questions, please feel free to reach out to us. Or if you do or do not receive, our e-newsletters or any of our emails, please, we invite you to visit our website. It was posted in the chat, keratosofAustin.org, and sign up for those. Or if you'd like to further engage, need support, make a gift, or just simply be an advocate for those that are experiencing homelessness, we want to hear from you. So thank you again for spending an hour of your afternoon with us. We hope this was informative. And again, want to continue, as Jason said, the conversation of what Housing First is and making a difference in the lives of those experiencing homelessness right here in our community. Thanks and have a wonderful afternoon and a great rest of your week.